last video, the last thing we talked about was the building blocks, okay? The 5 strategic elements that are basic building blocks to an effective QAPI program, okay? We talked about number 1, design and scope. Number 2, governance and leadership. Number 3, feedback, data systems, and monitoring. Number 4, performance improvement projects. Number 5, systematic analysis and systematic actions. Okay. The 5 elements are your strategic framework for developing, implementing, and sustaining QAPI. In doing so, keep the following in mind. Your QAPI plan should address all 5 elements. The elements are all closely related. You are likely to be working on them all at once. They may all need attention at the same time because they will all apply to the improvement initiatives that you choose, okay? Your plan is based on your own center of programs and services that you offer and your assessments of your current quality changes and opportunities, okay? So these are the 5 building blocks that's going to make sure that your QAPI is effective. When we talk about those 5 building blocks to an effective QAPI, I just want to go into a little bit more details about those 5 building blocks. Design and scope. That's an ongoing and comprehensive program, okay? It's always ongoing and it needs to be comprehensive, okay? The governance and leadership. Develop a culture. Seek input from facility staff, agency staff, patients and families and representatives, okay? Number 3, feedback and data systems and monitoring. Systems to monitor care and services drawing data from multiple sources, okay? Those multiple sources we'll get into when we actually look at an illustration of what a QAPI looks like. Performance improvement projects, PIPs. Concentrated effort on particular issues in one area of the agency or facility, okay? Systematic analysis and actions, okay? That's going to be systematic approach to determine when in-depth analysis is needed, problem causes and implication of change. Okay, 5 elements from the framing of your QAPI. We talked about the building blocks, and I just want to give a little bit more in depth of those topics and those building blocks. Okay. Now we're going to go a little bit in depth about developing a QAPI plan. Okay, we talked about definitions. We talked about the 5 building blocks. Let's go a little bit in depth about developing your QAPI plan based on the Texas Administrative Code. Okay, so we have QAPI goals. Based on the guide to develop purpose, guiding principles, and scope for QAPI, indicate the QAPI goals that your plan will strive to meet. Goals should be specific, measurable, attainable, relevant, and have a timeline for completion. Okay. Scope. Number 2, scope says describe how QAPI is integrated into all care services areas of your organization. Describe how the QAPI plan will address clinical care, quality of life, resident care, service delivery, action plans, ISPs, individual service plans. Describe how QAPI will aim for safety and high quality with clinical interventions if you have a skilled nursing a part of your agency, while emphasizing anatomy and choice to daily life for residents or for your clients. Describe how QAPI will utilize the best available evidence, data, national benchmarks, published best practices, clinical guidelines to define measurable goals. Okay. Number 3, guidelines for governance and leadership. Okay, describe how QAPI is integrated into the responsibilities and accountabilities of top level management, and board directors, if applicable. Describe how QAPI will be adequately resourced. Designate one or more persons to be accountable for QAPI leadership and for coordination. Indicate the plan for developing leadership and facility or agency-wide training on QAPI. Describe the plan to provide caregiver time, equipment, technical training is needed for QAPI. Indicate how you will determine if resources are adequate for QAPI. Describe how your caregivers will become and remain proficient with process improvement tools and techniques. How will you assess their level of proficiency? Okay. QAPI leadership, while everyone in the organization is involved in QAPI, you will likely have a small group of individuals who will provide a backbone structure for your QAPI in your organization. Who will be part of that group? Many of these individuals may be on your current QAA committee. Describe how this group of people will work together, communicate, and coordinate QAPI activities. This could include, but is not limited to, okay, establishing a format and frequency for your meetings. According to Texas Administrative Code 5558, you guys need to meet once a year, and more if needed, okay? Establish a method of communication between the meetings. Establishing a designated way to document and track plans and discussion addressing QAPI. Describe how the QAPI activities will be reported to the governing body, board of directors, the owner. Now let's talk about your feedback, data systems, and monitoring. Okay, describe the overall system that will be put in place to monitor care and services, drawing out data from multiple sources. Okay, in home health agency, multiple sources could be your satisfaction surveys, your EVV system, um, service delivery, um, your mock chart audits, um, complaints. Okay, identify the sources of data that you will monitor through QAPI: input from caregivers, residents, families, and others, adverse events, performance indicators, surveying findings, complaints. We talked about that. Describe the process for collecting the above information. Okay. Describe the process for analyzing the above information, including how findings will be reviewed against benchmarks and targets established by the agency. Describe the process to communicate the above information. What types of reports will be used? One way to accomplish this is to use a dashboard or dashboards for individual performance improvement projects. Identify who will receive this information. Okay. Now let's talk about the guidelines for performance improvement projects, PIPs. Describe their overall plan for conducting PIPs to improve care of services. Indicate how potential topics for PIPs will be identified. Describe criteria for prioritizing and selecting PIPs, areas importance and meaningful for the specific type of scope of services uniquely to your agency, requires a concentrated effort on a particular problem in one area of the facility and facility wide, okay, or agency wide. Indicate how and when PIP charters will be developed. Describe the process for reporting the results. Okay. Describe how to designate PIP teams and establish and describe a process for assembling teams to work on specific PIPs. Define the required characteristics for PIP teams. Describe your process for documenting PIPs, including highlights, progress, lessons learned. For an example, what project documented templates will you use to consistently and file electronically in a standardized fashion for the future references? And we can also talk about systematic analysis and systemic actions. Any change that is made has the potential to have broader impact and intended. If you are trying to make a change to a specific system or process, it is important to recognize any unintended consequences of your actions. Okay, describe how your organization will identify these consequences, which may be either positive or negative. Describe the process you will use to ensure you are getting at the underlying cause of the issue rather than applying quick fixes and address symptoms only. Okay, describe how you will monitor to ensure that interventions or actions are implemented and effective in making and sustaining improvements. Lastly, we'll talk about communications. Outline the audiences for your QAPI communications and frequently and format of these communications. Evaluations. Describe the process of assessing QAPI in your organization on an ongoing basis. Describe the purpose of this evaluation to help you organize or help your organization to expand your skills of QAPI and increase the impact of QAPI in your organization. Last but not least, establish a plan. Date your plan. Determine when you will revisit your plan, at least annually, according to the Texas Administrative Code. Determine how you will track revisions or updates to your plan. Okay. So I've just went over uh, guidelines for developing your QAPI plan. All this is based on the Texas Administrative Code, and I just went through some pointers on how you need to develop your plan, your QAPI plan for your organization. For our next video for QAPI, we're going to talk about the illustrating QAPI in action. I am going to go over several different scenarios for home health agencies, and we're going to talk about what that looks like. We're going to illustrate what those situations look like when we're gathering data from different sources within the day-to-day operations of the agency. And we're going to talk about the illustrating QAPI in action.